Quick note: this is an automated educational summary of public medical sources: Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. You've heard drug testing can be expensive, but here's the truth. Quest Diagnostics prices vary wildly depending on the test type and your location. Some cost as little as $50. Others run over $300. In this video, we're breaking down exactly what you'll pay for each test type, how the ordering process actually works in 2026, and what to expect when you walk into one of their location. Whether you're testing for employment, personal health tracking, or compliance, this is the only breakdown you need. Quest Diagnostics isn't a doctor. They're one of America's largest laboratory testing networks. According to the NIH, workplace drug screening has become standard across most industries, and Quest handles millions of these tests annually. When you order a drug test through Quest, you're ordering through a CLIA-certified lab. That's Clinical Laboratory Improvement Amendment certification, meaning they meet federal standards. You can order these tests without a doctor's prescription for most personal use cases. The test itself is straightforward. They collect a sample, usually urine, but also blood, hair, or saliva depending on what you order, and send it to their lab for analysis. Quest offers multiple drug test panels. A 5-panel test screens for marijuana, cocaine, amphetamines, opioids, and PCP. This is the most common workplace test, and Medline Plus notes it's the federal standard for DOT-regulated employers. A 10-panel adds prescription drug screening, benzodiazepines, barbiturates, methadone, and propoxyphene. There's also a 12-panel that adds additional prescription medications. The more panels, the higher the cost. A basic 5-panel typically runs $50 to $75 at Quest. A 10-panel jumps to $100 to $150. And if you need hair or saliva testing instead of urine, expect to pay more. Urine testing is the federal standard for initial screening, which is why it's the cheapest option. Here's what you're actually paying. A standard urine 5-panel test at Quest runs between $50 and $75. If you walk in without an order, you might pay full price. If you order online first, some locations offer discounts. A 10-panel test costs $100 to $150. Hair testing is pricier, usually $150 to $200 because processing takes longer. Blood tests run $75 to $125, depending on what's being tested. Rush processing, getting results in 24 hours instead of 3 to 5 business days, typically adds $25 to $50. These prices are ballpark figures. Your actual cost depends on your location and current promotions. Quest frequently runs discounts through their online portal, so if you're not in a rush, ordering online can save you to 10 to 20%. Ordering online is simple. Visit questdiagnostics.com or use their mobile app. Create an account or log in if you already have one. Search for the test you need. The search is straightforward. Select your test panel, 5-panel, 10-panel, or specialized panels. Choose your preferred location. Quest has over 2,000 locations nationwide, so you'll likely find one near you. Complete checkout and pay. You'll get a digital voucher. That voucher is your order. You don't need a doctor's order for personal testing. Take the voucher to any Quest location, and you're done. The whole online process takes about 5 minutes. You arrive at Quest with your voucher and photo ID. Check-in takes a few minutes. A phlebotomist or technician will collect your sample. For urine tests, you'll use a private restroom and collect a sample into a cup. For blood tests, they'll draw from your arm. Hair tests are the easiest. They cut a small sample from the back of your head. The whole process takes 10 minutes, usually less. The lab then processes your sample. According to the Mayo Clinic, standard urine screenings typically show results within 24 hours for basic tests. though say day to 2 to 5 business days is more common for comprehensive panels. You receive results through your Quest account online. You log in and see your results as soon as they're available. If it's for employment, your results go to your employer as well. Employers are the biggest users. Pre-employment screening, random testing, and post-incident testing are all standard. The Cleveland Clinic notes that many healthcare and transportation employers require regular testing. Individuals order tests for personal peace of mind, insurance purposes, or custody cases. Some people monitor prescription compliance. Athletes might test themselves. Courts order tests for legal cases and probation. If you're applying for a job, ask if they use Quest. Many major employers do, so you'll know exactly where to go. If you're doing this for personal reasons, you have complete privacy when you order online. Your results are yours alone unless you authorize release to someone else. Results come back as either negative or positive. A negative result means no substances were detected above the screening threshold. If the result is positive, it doesn't necessarily mean substance use. It could indicate a false positive, which is why confirmatory testing exists. The lab will flag anything that needs confirmation, and that confirmation test is more expensive and takes longer. That's why your initial test is inexpensive. It's a screening. If you're concerned about a result, Quest allows you to request a retest or request a medical review officer review if it's for employment. The MRO is a neutral physician who evaluates whether prescription medications might explain the result. Medline Plus clarifies that many prescription drugs can trigger positive results, which is why this review process exists. Remember that drug tests are screening tools. Research from the NIH shows they're useful for specific situations, but they're not diagnostic. If you have health concerns, discuss them with a healthcare provider. What type of health tests are you interested in? Comment below and we will make a video about it.